Hello, this is Teresa, 4th floor.
Hi, this is Karina RN from the emergency department. I was calling to give a report on Eliana.
Okay, I will be taking care of that patient.
Okay, Eliana came into the emergency department at 7:30 with a 3-day history of sore throat and increased thirst. She has had a frontal headache and her appetite was decreasing. She lost 20 pounds in the last 4 months. The provider saw her earlier this morning and her urine was positive for ketones and glucose. The physician in the ER said Eliana was dehydrated and diagnosed her with type 1 diabetes. Her mom is with her now and asking a lot of questions. She's going to need your support and instructions, as well as reinforcement on any teaching. We will probably discharge Eliana in a day or two. Right now, her vital signs are temperature 98.9, pulse 83, respiration 17, blood pressure 100/43, O2 saturations at 98% on room air. She weighs 105 pounds and is 62 inches tall. Her blood glucose reading is 497 and her laboratory reports are sodium 129, chloride 90, her hemoglobin A1C was 14.9, and venous blood gas is at a pH of 7.17, PCO2 is 37, PO2 is 55.3, HCO3 is 23.3, and base excess is 1.4. Her glucose decreased after IV hydration. 2 hours after her arrival, her blood glucose went down to 258. Her most recent glucose at 11 was 168. At 7:45, an IV was started in Eliana's right antecubital space. She received a bolus of 1 liter of normal saline, which was given to her over 1 hour. She's now receiving maintenance fluid dextrose 5% in 0.2% normal saline, with 20 of potassium chloride to run at 120 on an IV controller pump. We gave her sips of clear liquids, but she's not tolerating them. I'd like to transfer her in about 15 minutes. Her provider already put the prescriptions in the computer.
Okay, thank you for that report. Karina, is there any orders for Phenigrin?
No, ma'am.
Okay, I will talk to the doctor now. Thank you.
Thank you.
And the nurse walks in, identifies herself, and performs hand hygiene.
Hi, I'm Teresa. I'll be your nurse for today. Can you tell me your name and date of birth?
Eliana Garcia, 4/30/2003.
The nurse performs the physical assessment.
Okay, I'm going to take your blood pressure.
Ma'am, why are you doing that?
She needs to have her blood pressure checked. It's part of our routine assessment that we do on all patients.
Okay, have y'all figured out what's going on with my daughter?
The doctor will be in soon to talk to you.
Okay.
It's not something I can discuss.
Okay.
Can I borrow your arm for a second?
I'm just really tired of her being so sick, you know?
I understand. It can be frustrating. Okay. And if you don't mind, I'm going to listen to your lungs. Could I have you sit up just a little bit? And I'm going to put this on your finger. I'm just going to pull your cover back here and check your belly. Okay, I'm going to check your feet right quick.
The nurse is inspecting the extremities for edema. as well as checking the IV site.
When is the last time that you voided? When's the last time you went to the bathroom to pee?
A little while ago.
Okay. All right. How's your throat? Is not hurting anymore as well? How are you feeling? Okay.
Not good.
No. How's your headache?
Okay, it comes and goes.
On a scale of 1 to 10, what would you say it is?
7.
7. Do you have any questions, Mom?
I was just wondering, how's her blood sugar and everything doing? I know when we first came in, it was kind of high, but the lady came in a while ago and took it, and I never heard back from that. So I just wanted to know.
It is coming down. The
Okay.
CNA came and took her blood sugar a while ago, and it is coming down.
Okay.
So the treatment is effective.
Okay.
Okay. So we're going to have dietitian come in just a little while and talk to you about her diet to where it can maybe be adjusted to where she can control her sugars a little better.
Okay.
Do you have any questions? Here's your call line. If you need anything, don't hesitate to call.
Thank you.
Thank you.
Prior to walking out, the nurse performs hand hygiene and documents.
This is Teresa from the 3rd floor. Can I talk to Dr. McLovin?
This is Dr. McLovin.
Hi, this is Teresa. I'm taking care of your patient, Ileana. She's having a headache that's 7 out of 10 on the pain scale. Would you like to prescribe her anything for the pain?
I actually have put in a PRN Tylenol into her EMAR. If you want to go ahead and pull that up and follow the order, we could do that. And then if you can go back and reassess her pain in 1 hour. And if it hasn't been effective, please call me back and let me know.
Okay, I will do that. Thank you so much, Doctor.
Thank you.
Bye-bye.
Dietary enters the room and performs hand hygiene.
Hi, my name is Nicole. I'm a dietitian. I'm here to talk to you about Eliana's nutrition needs. I've got some paperwork with me that I would like for y'all to take home, but I just want to go over a couple of things with you before y'all leave and make sure
Okay.
you understand everything.
Okay.